The instructions give you the option of either reporting on the entire quarter, so the 13 weeks of January 1st to March 31st of 2022, or any 12-week period in the quarter. So for example, if you're going to be pulling information out of your payroll reports and you do bi-weekly payroll reports, and it would be a hassle to do a quarter, because of the 13 weeks, you could do January 2nd through March 26th, or if your payroll starts on a Monday, January 3rd through March 27th, or January 9th to the April 2nd, kind of get the idea there. And so the two tabs, 2A is going to calculate things based on 13 weeks of data, and 2B will calculate based on 12 weeks of data. So we just wanted to drive that home, that's done for your streamlining, for your convenience, to make things easier. You only have to do one. Definitely don't do two. We don't want to deal with two, and I know you don't want to have twice as much work as well. The second tab that everyone does is the step 1 tab. This tab should be pretty easy, starting with nice, easy, basic information, entering contact information in the upper left. In those green and white rows, it's password protected. You can, when you click on that Excel sheet, you can just do save as, save it to your hard drive, and then make any changes to it. As Wendy mentioned, you'll upload it when the application's live. But when you save it, you'll be able to enter data into any of these green and white fields. The gray fields are samples. So for example, again, company is defined by the EIN number. So any of your companies that have multiple facilities, multiple lines of business that fall under eligible employers, you'd be able to enter any of those eligible employers, ideally in this format. So you can see in the example, Main Street Nursing Home would in Burlington would type in Main Street Nursing Home - Burlington. If the company also does home health visits, that's obviously not one town that they're based in, but still that using that same syntax, home health visits to homes in Vermont - Franklin and Lamoille counties, or if that's the area of service. And that's this tab here. We should mention, as far as the eligible employers go as well, we've gotten some questions. For example, a hospital that runs an adult daycare facility. So the hospital isn't listed, and many of the hospital's line of work aren't listed under eligible employer, but that adult daycare facility would be eligible, so they could be entered in here. And then on the next tab, we're going to go to, you choose, for this example, we're going to choose 2A. So this is somebody who determined doing that report based on the full quarter is easier, preferable for them than doing the 12 weeks. So they would come in that step 2 tab, whether you choose 2A or 2B, you're going to see there's 4 tables in there. So we'll go over those 4 tables that are on that one sheet. The first is table I for full-time employees, with full-time employees being defined as working 35 hours per week or more. So any employees you have that are working 35 hours a week or more, you would enter ideally their employee number if your company uses employee numbers. So employee number 34567 is in there. That's obviously a unique employee. You don't have to worry about caveating that with a unique identifier. You would then go to primary work location. That's going to be a pull down menu populated by the information you entered into step 1. So you can pull down, select that they work out of that Main Street Nursing Home in Burlington. If they were on your payroll the entire quarter, you would enter 13 weeks in the number of weeks on payroll. And again, you're doing this down in the green and white fields below, so it's going to automatically calculate that full-time equivalent. You only do the green and white parts. If, for example, you had a different employees or this is probably unlikely. If you have employee numbers, you're probably going to have employee numbers for everybody. But if you're a company that doesn't have employee numbers, you might enter Jane Johnson, and then to give the unique identifier, just in the event there are people with the same names, putting in their birthday there in that unique identifier column. Again, selecting the primary work location, and if she's on the whole 13 weeks, you'd put the 13 weeks. If somebody started 2 weeks before the end of the quarter or departed 2 weeks after the start of the quarter, they were only on payroll 2 weeks, you'd put a two there. I see the question coming up from Alexa. As we noted kind of up at the top there, the table I, full-time employees. For this purpose, a full-time employee is anyone who works 35 hours per week or more. Anybody who works less than 35 hours per week is going to be in this second table, table 2, or table II. In the format, what you're going to enter there is going to be the same. You are going to again enter the employee number. If they don't have one, you do name, birthday again, their location, number of weeks that they were on payroll, and then in the case of the part-time employees, you're going to put the total number of hours that they were compensated for over the course of the look-back period. So in the case of the tab we're looking at, 2A, that look-back period is the full 13-week quarter. So total number of hours they were compensated for in the quarter. If you opt to do the 12-week option, then that's the total number of hours they were compensated for in the 12 weeks. And the instructions in table 2B will tell you that. The third table, table 3, this is again the request we heard. We heard a lot of the feedback from provider groups and associations that with vacancies, being able to try to use this as a recruitment effort, even though it's premium pay, has to be paid for work performed, to the extent that you'll be able to use it for recruitment. Wanted to make sure folks had funding if there were budgeted positions. So table 3 gets at that. This can be data. If you have a budgeted positions report, you could enter that information in here, or if you otherwise have information of how you have vacant positions, you'd be able to list the name. Ideally, if there's a position number, you can put that in there. If you just use position names, senior nurse and so forth, you would put that in. I'm seeing the sick and vacation time in work hours. Yes, that's why we framed it as hours you were compensated for. So in the case of the full-time employees, it's just the number of weeks they're on payroll. Assuming they were on payroll all those weeks, it doesn't matter whether they were sick or on vacation, they were payroll, they were a full-time employee. If they're a part-time employee who are granted vacation or sick hours, presumably they're compensated for that, sick time, vacation time. So that would be able to be backed up in the reports, and so those would be the total number of hours on the last one we were on the table 2. In the case of these vacant positions in table 3, again, we're putting in those position numbers. You would include, for this purpose of vacant positions, you want to include any that are filled by contract staff. So if there's travelers or other contract staff, you want to be including them in table 3, whether those positions are completely vacant or whether they're filled by, temporarily filled by contract staff. And then you're going to put in the number of hours that were budgeted, for that period. And so if you had a position that was vacant for, for part of the period, for example, if this position 0056, flipping back to the last slide, was filled by an employee, this employee 45678 filled that position for 2 of the weeks, they're showing up for 2 weeks on as a full-time employee. So you're not going to want to double count that. Instead, you would be entering that position for the other for the other periods. Say that person filled it for a few weeks for the first 2 weeks, then it was fully vacant for 3 weeks, and then filled by a traveler for 8 weeks. You would lump together those 8 weeks of traveler time and the 3 weeks of fully vacant time to be 11 weeks of vacant time. And if you budget that position for 40 hours a week, then you would enter 440 here. So 11 weeks, you had it budgeted at 40 hours per week. It was vacant for 11 weeks. You enter the 440 there. And then in table 4 is the simplest table, just a single cell. And that's just out of all those vacant positions, how many total hours were covered by contract staff. So in this column in table 3, you're entering the number of hours that were budgeted and vacant, whether they were completely vacant and or whether they were filled by a traveler. So in this example, if say these first 2 positions, that 455 and the 480 were were completely vacant, not filled at all, and then out of the 440 and the 320, you had 220 of the 440 were filled by a traveler, and all 320 were filled by a traveler here, you would enter 540 up in table 4, because you had 540 hours of the vacant hours that were filled by and were covered by contract staff. And so that is the extent of the spreadsheet, those 2 tabs. As you have a chance to look at it, we're more than happy to talk about it next week to take questions. We realize we're at time. We realize we messed up most of the time. If people have to go for 1 o'clock meetings, we're happy to let you go and follow up with these questions. We're also happy to stay on now and answer some of these questions that have been posted for people who can stay. And as Wendy noted, we're recording this, so we will post this recording, make it available to you as we answer these questions, and also address them in the future. So I see a lot of questions coming in. Wendy, should we start? I'm thinking it may be easiest to start with the questions from the other event. If that works, Wendy. We had one question was, can we use the funds for work performed in the past? The instructions refer to work performed between April 1st, 2022 through the end of the public health emergency, or June 2023, but is the intention to include work performed in 2020 if we choose?
Yes, so the work performed has to be 4/1/2022 or later. The premium pay would need to be made after grant funds are received. So the intent here is to allow premium pay to be paid immediately upon your receipt. But again, it has to be for work performed, so that work performance time period can go back to April 1.
Great, thanks, Wendy. Yep, and so to be clear, it's to that direct question, can't be used for work performed in 2020, but it can go back, as Wendy said, to April 1st, 2022. It asks, are direct support positions eligible, such as receptionists, security guards, cleaners, maintenance people, etc., who are client facing? And so to the answer here, again, there'll be the two pieces that to this, to the question. And as we noted, we'll be talking about the eligible employees, for the payouts in the subsequent sessions. For the purposes of filling out the spreadsheet, anybody who is an employee, or again a vacancy or contract staff, as noted, who are working in those facilities, in those locations, that are doing this eligible work, they would all be able to be entered into the spreadsheet for this calculation. The next question we have, what happens if quarterly payments are selected for allowable 12-month disbursement period? But the COVID-19 public health emergency ends earlier than June 30th, 2023.
Do you want me to answer this one?
Sure, you can jump in. Yep.
So the public health emergency in this guidance, it's based on state fiscal recovery fund federal guidance, and this is the presidential proclamation. So we have information in the guidance document about how to locate that. But again, the premium payment is made based on work performed. So if the COVID public health emergency ends during this time period, you can still provide the premium pay for work performed prior to the end of it. So you can continue to make payments. You just can't make payments that are tied to work performed after that date.
Great. Yeah, thanks, Wendy. Yeah, so as a takeaway, you don't have to worry about losing funds or not being able to use them by choosing a quarterly versus a lump sum.
There may be more restrictions on how to use them, but there's still opportunities to use them.
Exactly. Yep. The next question is similar. I think we answered those. Does 24/7 residential direct staff include dining, housekeeping, and all staff working directly in a facility? I don't know if there's anything you want to add to that one, Wendy, or if it's covered in the largely covered in the answer I gave before.
Yeah, I just want to be clear. We're really talking about how to fill out the FTE spreadsheet, and that is based on the employees of the eligible employer. So we're not making this distinction, which we do in the program guidance, which is the eligible employees who can receive the funding. So you don't have to do that test on every employee that you're including in your FTE calculation. They just have to be employees of the eligible employer.
Great, thanks, Wendy. And the next question, and we'll flag that similar. Can you go over the exact requirements for the eligibility for each employee and how it interfaces with the PNMI rate setting? That's, I think, similar as Wendy noted, is addressed in the eligible employee portion of the guidance, and we will speak to that in upcoming webinars, but didn't want to mix things up in types of employees for the purposes of the FTE sheet here. It's a question, what reporting requirements will there be? I think that's also, we'll get into the details and depths on that in upcoming sessions. There'll be reporting, and the guidance does speak to the reporting that will be involved, whether you choose the one lump sum or the quarterly, and how the reports differ. I don't know if, Wendy, if there's anything you want to add to that, or best to point to the guidance for now and picking up those details subsequently.
That's right. We'll be providing more guidance on reporting requirements. Yep. There are single audit requirements that are already included and specified, I believe, in the program manual, but in terms of what our reporting will look like, we'll be providing you with more information.
Great. There's a question about contract workers. I think we've addressed that. They should be, contract workers should be included in that table. III, table 3, Roman numeral 3. There's our nursing home administrators excluded from the clinician list intentionally, as they are healthcare licensed profession, but not listed. That may be one to look into and follow up for next week. I think the details there. I think although certainly for these purposes of the FTE, administrators would be, you know, if they're employees of that EIN number and they're working in that facility, they would be entered here in the FTE report. This question: do independent contractors qualify if they're replacing full-time staff? Again, in that table 3, they would be under those vacant positions. We have what's considered.
Yeah. Can I just say, make one more point on that? So this is really looking at vacant positions. So we need to know that there is a vacancy, not just adding contracted staff to this, but it's okay if you're having contract staff perform the roles of that vacant position while it's vacant. I just wanted to provide that clarification for what should be included in table 3.
Yeah. Yep. Great. Yeah. Thanks, Wendy. Great clarification. And the question of what's considered premium pay. Premium pay at a high level, and the distinction of it is that it's pay for work performed. So it's not a hiring bonus or something you would pay to somebody before they start work. This is work. This is pay on top of their normal wage or salary, and again, it's paid after the work is performed. So if we are trying to hit the recruitment and retention, that's where this option of the quarterly payout comes, or the options of the payout for people to be able to take the grant and use it to let folks know that this premium pay would be made for a set period after they come on and after they work. But that's the key distinction there. It's discussed in the guidance a little bit. Wendy, I don't know if you want to speak anything more to that at this time.
Yeah, I think I'll just speak a little to, we've gotten a few questions about this 2,000 per FTE versus how premium pay is defined, which is this up to $13 per hour or $25,000 per single individual. Again, the calculation for your grant award is this FTEs times 2,000. The employer then has the discretion on how to disperse those funds to their employees in ways that meet the aims of this program. So then how it's dispersed is really related to, you could do anywhere within that range, that is that allowable range I just mentioned, which is the $13 per hour up to $25,000 per person. If you are trying to incentivize certain positions over others, you could be coming up with the program that works best for your organization. We don't have other guardrails other than that piece, and it doesn't have to be 2,000 per person that is in your FTE spreadsheet. The calculation is sort of separate from how you're dispersing the funds. And I know we're going to get more into disbursement. I just saw we had a number of questions related to that.
Right. Yeah, that's helpful. Thanks, Wendy. We also have a question of whether the grant is first come, first serve, and I assume that's referring to, do you have to apply on the first day of the grant next week? And that isn't. There is some option discussion in the program piece for the way this was funded. Actually, it was from 3 different funding sources, discussed of federal and state dollars that the legislature allocated $45 million for this grant and this grant program, and an additional within a total workforce package of $60 million in grants. And so the approach, the short answer is it doesn't matter if you apply on the first date, if it's the 18th, the 24th, if you apply on the 18th or the 24th. These will all be taken together and in reviewing and going through. will be assessed at that point. And so I think we have to see what comes in, but people that apply on the 18th won't be treated any different or have any preference relative to people who apply on the 24th. We have a question here shifting over to this Teams. Those are everything from the live event, shifting over to the ones in the chat here.
And I know, Sean, for some of these, I just wonder if we should take one more, and then we'll start developing our frequently asked questions, which we can then start incorporating this into it and bring it to our next, as questions that really help us kick off our next webinars.
Great. Yeah, and that may be a good breaking point too. Actually, I see some of the questions on this chat are pretty substantive, and recognizing that we have kept folks over 15 minutes. I think that is probably a good segue. Again, we'll look through these questions. We'll develop FAQs preparation for next week on them, and again, encourage all of you to look at the materials on the website, and ask other questions from there. There is a link on the website too. We should have flagged if there's questions that aren't addressed in the program materials. Again, I thank you all for joining us today. I apologize for the technical difficulties at the start of the call, and we'll look forward to working on this program with all of you.